Thank you, everyone, for coming, and thank you to those of you online. The TOPS program is very happy to have another opportunity to host a consultation with USAID. As you know, over the past couple of years, we've hosted several consultations on the RFA structure, several consultations regarding Food for Peace's new strategy, which is in development. And we're very happy today to now have an opportunity to have a consultation on monitoring indicators for the multi-sectoral nutrition strategy for 2014 to 2025. Before I forget, the bathrooms require a key. The key is good for either men's or women's. Men's is straight down this hall, women's is a little to the right. So with that said, we'll move onward, and we're very happy to have a broad spectrum of USAID staff with us today. We have our friends from Food for Peace, Arif Rashid, and Mike Mansky, who's newly with Food for Peace, but lots of people know him already. We have Melanie Thurber, I think, will also be trying to get online shortly. We have Sally Abbott from the Bureau for Food Security. Just wave, Sally. And Ann Swindale from the Bureau for Food Security, and Elizabeth Bontrager from Global Health, and Raphael McConan from Global Health. So with that, I'm going to leave it in your hands. Thanks.
Thank you, and thank you everyone for coming today. We really appreciate the opportunity to talk with you, to get input. We really see this as a consultation process and are looking for input. We're not just trying to share what we've done. And we also really want to thank TOPS for agreeing at somewhat of a last minute to pull this together and to host this for us. In the nutrition strategy, which we developed over the course of 2013 and 2014, we said that we sort of kicked the bucket on developing indicators, that we needed more time to figure out how we were going to monitor the strategy, how we were going to have sufficient indicators for the wide spectrum of what we're proposing to do under the strategy, and that we wanted to have the time to think about it, have the time to have a consultation process, and we didn't want to hold up getting the nutrition strategy out to have this as really an inclusive and thoughtful process. On the timing, we of course have now come on a deadline. There's a standard program structure and standard reporting structure for all of foreign assistance. And every couple of years, with a little notice, that structure is rejiggered in some way, and that is ongoing right now. And so the entire reporting structure for foreign assistance is undergoing this process where I think by next week, by the end of next week, we have to submit any new indicators that we want included for next year. That means that we need to sort of finalize at least the names of any new indicators we want to include in the standard reporting across the board. That being said, there are many different types of indicators that we have that we're sort of proposing and that we use. We have the outcome and impact indicators, which we primarily use secondary data for. We have included a lot of those in this, but that's probably not what we want to spend the bulk of the time talking about now. Those are indicators that we're a little less sort of pressed on the number we can have because they come from other data sources. So we're talking about the stunting, the minimal acceptable diet, the exclusive breastfeeding, the indicators that are collected through population-based surveys on a regular interval that we think are important to measure sort of the outcome and impact of programming. But we don't expect implementing partners for the most part to be collecting regularly every year through the regular monitoring system, since we wouldn't expect that to change that quickly. And the cost of reporting would be a little bit much. We also have sort of the primary data collection from implementing partners. There's two types of indicators that I think we have under there, all of which are generally sort of the output level indicators. They're the ones that we use for project monitoring, that projects themselves use to make sure they're keeping
checking the audio. Can you hear us? Can you hear us?
What is applicable across the board. So there are a lot of indicators that are really good, but they're pretty specific about one specific item or one specific area that we're measuring. And that's not the level that we're getting into. We want to have indicators for the global reporting that you can actually have 5 or more missions, projects, countries reporting on. One of the reasons for this is that in the new program structures or the new foreign assistance reporting system, we are only allowed to have indicators that we plan on using for some reporting or internal process. So we can no longer just collect an indicator because we think it sounds like something we want without explaining how we're going to use it. Since we do have the reporting for the strategy, I think that we have some room to say, there are more indicators, there are more times we're going to be using indicators to talk about what we're doing, but we don't want to be overburdensome with the list of indicators. Any indicator that we put in this process as a standard indicator is going to be required, if applicable, to any USAID-funded project that is working in that area. So that's a burden. We currently have way more than we can actually include, so we need help figuring out how to cut them down. We also have some gaps. So we are looking for suggestions on how to cut down the list. We also have suggestions on where to include other indicators. Keeping in mind that if you're saying you should add this indicator, please let us know what we can take away, because, or what two we can take away, because there's too many. So what we've done to get to this list is we went through the results framework of the multi-sector strategy and went first at the goal and the strategic objective level, and then every IR and every sub-IR, and brainstormed in a group about what indicators exist and what we could possibly do to measure every single sub-IR. We're not really sure that when we're reporting on the strategy, we should be reporting at the sub-IR level. That being said, there's probably 1 or 2 indicators at the sub-IR level we may want to include, but we're not sure that we need to be getting into. We certainly cannot report at all 16 sub-IRs. That's too much. That's too much collection. That's too much data. We just probably won't use that. So help us think through which are the ones we should be including and which are the ones probably aren't as important to be reporting on a global level, which doesn't mean that they shouldn't be reported on for projects that are working in that area, but we're only going to narrow down the ones that we're only going to talk about the ones in blue, which are the ones that we're proposing to include. But we wanted to make sure everyone could see the full list so they could see sort of what the thinking and the process that we've gone through to get to that. We tried to use indicators that sort of already existed somewhere. So we looked at some of the sun indicators, we looked at some of the existing indicators, and we looked at other health or agriculture areas to see if there are indicators that we could draw on that have already been used. What we're going to do today is we're going to go through our full presentation from the goal and the strategic objective level to each of the IRs and try to get through the whole thing. And then we're going to go back IR by IR for discussion. We're not going to spend as much time discussing the goal and strategic objective because that really hasn't changed much from what we proposed in the original strategy, and that's also almost entirely using secondary data sources, so there's not as much implication on implementing partners to collect that data. That being said, we do want your feedback on all of this. So we have feedback forms that we're going to distribute for you to write any additional comments that you don't have time to give us today, because we may not have time to get to everyone's great ideas. And we also have set up an email address, which I don't know off the top of my head. It'll be at the end, that if you have additional thoughts you want to think of, if you wake up at 3 a.m. and have some great idea on how to measure something, then please share it with us. And I really want to reiterate that this is what our 3 bureaus have been thinking about and talking about and discussing, but we really want to have you as experts help us with this. And while this is sort of the first time we're having a consultation, we do want to hear continued feedback. We really are here. If you think something we're proposing is absolutely nuts, please tell us that. If you think it's brilliant, we'd love to hear that as well. But we do want to hear from you. This is by no means set. This is just sort of an initial thinking and thought process. So with that said, I'm going to hand it over to Raphael to talk about the goal and strategic objectives.
Great. Thanks, Sally. So we'll go through the goal and SO level indicators relatively quickly, given that they're mostly going to be, we're going to be relying mostly on secondary data sources such as DHS, NICS from UNICEF, as well as the Feed the Future Zone of Influence surveys, and therefore will not constitute much of a reporting burden on implementing partners. But if you do have, like Sally said, comments on these, please do share it with us. So the overall goal for the nutrition strategy, and it's circulating, or there are a few copies there on the table for those who want to refer to the whole thing. We have aligned the goal, most of the goal level indicators with the World Health Assembly targets, and also are currently mentioned in the strategy. The first two are stunting among children under 5, as well, and wasting among children under 5, followed by overweight among children under 5, and anemia among women of reproductive age. And all of these within USAID supported countries by Feed the Future and other, and the Global Health Initiative. And just to read the goal itself: improve nutrition to save lives, build resilience, increase economic productivity, and advance development, which is a broad goal. And one question may be, for example, do we include child mortality, given that it's lives, and how strong would that link be? The remaining 2 indicators we propose under that goal are prevalence of healthy weights among women of reproductive age in USAID-supported countries, and prevalence of anemia among children, both of which are not part of the standard World Health Assembly targets, but nonetheless are what we propose to measure goal-level impact. Then this is followed by the SO level indicators that we propose. And I'll read the SO just for clarity's sake. So it's to scale up effective, integrated, nutrition-specific, and sensitive interventions, programs, and systems across humanitarian development contexts. That's a lot, and it's hard to measure all of those constructs, obviously. But what we propose as indicators is prevalence of low birth weights, prevalence of exclusive breastfeeding among children 0 to 5, prevalence among women of reproductive age, prevalence of women of reproductive age consuming a diet of minimum diversity, and then lastly, the minimum acceptable diet among children 6 to 23 months. And these are all relatively standard indicators. The somewhat new one is the prevalence of women of reproductive age consuming a diet of minimum diversity. So that may be one area for questions or comments. And that are the goal and SO level indicators, and we'll now go on to IR1.
Okay, great, thanks. So for IR1, it's the IR that we've actually got the most indicators identified for, and not surprisingly, I think, because it is the range of nutrition-sensitive and nutrition-specific delivery of these services. So at the overall IR level, you'll notice in the handout that all of the indicators that we are proposing are from secondary sources, either DHS or the NICS or the Feed the Future population-based surveys in the zone of influence. But one thing we wanted to point out and welcome feedback on is that we didn't choose, for example, just percent of women overall who have tablets or iron supplements during pregnancy. We wanted to get at the aspect of the IR that is the equitable provision of these services. And so we have formulated the indicators in the list right now so that it measures specifically the prevalence and access to these types of services among women in the lowest wealth quintile. And we're able to do that with data, definitely if it comes from the DHS or if it comes from the zone of influence surveys, because the DHS has a socioeconomic scale they develop and the ZOI surveys have poverty measures, so we can create those kinds of quintiles. What we debated a bit, and we would welcome your feedback on, is there were a couple of ways we thought we could capture equity. One, which is just looking at the poorest 20% of the population. The other is to take those same measures, but present them as the ratio of coverage between the top quartile and the bottom quartile. And we think that the latter may be a more direct measure of equity, but may be less intuitive and understandable to a broader audience. So we've gone with the bottom quintile because we think that's more intuitive and understandable, even though it's a slightly less direct measure of that equity. So any feedback that you'll have on that idea, we would definitely welcome it. Did it move? Okay. All of the indicators that we are proposing exist. We pulled a lot of them just going to DHS reports and saying, "Oh, look at that! Oh, look at that! Look at that! I didn't know that was there." But there are two that we are classifying as new. They were introduced actually last year, so many of you may be familiar with them. But and we just measured them and are measuring them for the first time in 2015 in the interim surveys in Feed the Future Zones of Influence. And they are indicators that are aimed very specifically at trying to capture results of one specific kind of nutrition-sensitive agriculture intervention, which are value chain activities that have selected nutrient-rich commodities to promote for specific nutrition objectives. Okay, and these, so we are measuring and proposing to include these two new indicators that then measure what proportion of women and children in our zone of influence are actually consuming these commodities that we are promoting. And we have a whole list of criteria of what constitutes a nutrition, what the definition of nutrient-rich commodity is. Then now moving down to the first sub-IR level, increased timely delivery of critical services before and during humanitarian crises, we've identified a couple of sets of indicators to capture two broad areas of humanitarian services during crises. The first set of three that you can see really deal with the ability to effectively deliver services to address acute malnutrition. The first one, and anything in italics on these slides, is an existing indicator that is already being reported on, and then the non-italicized with the blue parentheses are indicators that are going to be new in one way or the other. So the first three capture the acute malnutrition side of the picture, and the first one, the institutional capacity, the systems capacity to be able to address and provide these services. On the second two, they're not new for OFDA awardees, but they would be new as a cross-cutting indicator requirement for any program that is providing services for either moderate or acute malnutrition. And that's an output indicator that's simply basically counting your caseload disaggregated by sex and by critical age ranges. The fourth indicator is an existing indicator, and it's basically capturing the resource transfer piece of social safety nets in an emergency context, but you'll also see, we'll come back to that indicator, and you'll see it again when we get down to the nutrition sensitive interventions in the whole social protection area. And it is an existing indicator that is reported on by Food for Peace programs and others. Okay. So the second sub-IR is the increased availability of nutrition-specific services and commodities. And here we are proposing some tweaks, big tweak, to existing indicators and some new ones. So Sally already mentioned that we have been reporting on this indicator of number of children under 5 reached by U.S. government-supported nutrition programs. But it's a combination of kids reached through child health days and then kids reached at a community level with really intense interventions, and we can't say what those are. And so it becomes a very untransparent number. And we want to introduce a new disaggregate for this indicator that would have the requirement that the children be disaggregated by the type of service that they received. And then we'll complement that indicator with an indicator that's going to be measured in the Global Health Dashboard for ending child and maternal preventable deaths, which is having missions report on the number of districts in which they are implementing nutrition interventions and estimating the coverage of children within those districts. And we will then count the number of districts that reach a certain threshold of coverage. Right now it's proposed to be 50, but in other places we have proposals for 80% coverage. And so it is still to be determined, and there isn't a lot of real evidence out there. You know, what's the tipping point of coverage? We know we want to reach, for example, all children in the 1,000-day period. We also recognize we probably never will reach all 100% of children in a population. So what's the aspirational threshold to be setting that will get effective change of a distribution at a population level, but without putting the bar so high that nobody will ever be able to reach it, which is never a good idea. That we've already kind of identified is that these are children who are reached by programs on an ongoing basis, not the periodic child health days.
Testing the microphone. Can you confirm that you have audio, please?
They are benefiting from multiple strategic contacts, right? Because these are things we really believe are essential. I think they, on the online they can probably hear me just because I talk so loud, even without them. They lost my train of thought. Multiple repeated contacts. Oh, because we believe that these are really components that make community-based programs effective in preventing stunting in the 1,000-day period. So we're trying to capture elements of that. We believe that these programs should always include a social and behavior change communication component, and that they often will also include a water and sanitation component and or some component that is linking the mothers and children to both preventative and curative health services. We didn't want to require that all 3 components always had to be there for it to qualify as a community-based program under this indicator, but we would welcome your feedback if you think we should go to that level of requiring all 3 instead of at a minimum requiring that there is social behavior change communication. And then they may also include water and sanitation. They usually include growth monitoring and promotion and the links. And then they may also include the water and sanitation and activities aimed food-based activities aimed at increasing access to diverse foods, homestead gardens, provision of specialized food products, et cetera, and that we don't want to make a requirement to be able to report a child under this indicator. The links to the preventative services often include making sure that when the Child Health Days happen, when the campaigns happen, that the children show up. But if the only thing the child received is something through a Child Health Day, then you wouldn't be counting the kid under this indicator. Yeah. And then the fourth and final indicator that we're proposing for general reporting under this indicator is an existing one that's reported by the PEPFAR programs that are doing nutrition-related activities for HIV. And that's the number of HIV-positive, clinically malnourished clients who receive therapeutic or supplemental feeding. And all PEPFAR programs that are doing these activities should already be reporting on this piece of information. So then moving to IR 1.3, this is our nutrition sensitive intermediate result. And we went back to the strategy and we looked through the areas of nutrition sensitive work that were identified in the strategy, and then tried to identify one or two key indicators that would help us address whether things were happening that would improve these underlying determinants of nutritional status. And so the first set are all existing indicators, but they're indicators that are capturing increased access to water, to sanitation, to family planning services, and early childhood or basic education. So these are all existing indicators. They're not specific, obviously, to a nutrition component, because we recognize that these are determinants that need to be addressed in order to be able to address in a multi-sectoral fashion nutrition as laid out in the strategy. Here's the social assistance programming indicator again that I mentioned before under social protection, but this could be now a more developmental focused conditional safety net that, for example, that's providing the rations if mothers take their kids to the health center, et cetera. And then in ag, near and dear to my heart, we have three indicators here. The last one is an indicator of women's empowerment, which we recognize as a critical determinant. But it is a population-level indicator measured in the Feed the Future zones of influence, so it's a secondary indicator. The number 7, I'm going backwards, number 7 is another indicator capturing that value chain targeting nutrient-rich commodities that I mentioned earlier. But this is one that is actually collected at the direct beneficiary level, not at a population level. And it is trying to measure how much of those commodities are the beneficiary producers putting aside or consuming themselves, not just that 100% is going for sale. And that's not necessarily saying 100% going for sale is a bad thing, because there you're just looking at the income pathway, right, to getting to improved nutrition. But we do believe that if there's increased availability on the form of nutrient-rich commodities, it's probably a good thing that they reserve some of it to consume themselves. And we're currently working with Spring on sort of piloting this indicator in a number of different countries, because we recognize there may be some challenges in collecting data on some of these nutrient-rich commodities, because a lot of them are perishable, they're harvested all year long, and so there may be some real unique data collection challenges, and we want to be able to provide some guidance on that. But number 6, I have to put down the, and sorry for people on the line, but I have to put down the mic for a second. Okay, so, well, when we were talking about developing these nutrient-rich value chain commodity indicators originally, one of my objectives certainly was to try to come up with something that wasn't overly burdensome for implementing partners to report, and that could be piggybacked on information that they were already collecting. As part of Spring's work in pilot testing the nutrient-rich indicator, they've discovered, to my delight, which is why I went, wah, ha, ha, that 2 out of the 3 implementing partners that they worked with in Cambodia and Bangladesh were collecting information on dietary diversity from the direct beneficiary while they were collecting the information on gross margin, which we're piggybacking the number 7 on. And I was, Sally too, just delighted because my assumption was asking partners to do that was beyond the pale. And apparently it may not be, okay? So we debated this back and forth a little bit if we wanted to try to say, get a measure of household dietary diversity, but what we've ended up doing is narrowing it down. So it's the direct beneficiary herself, right? Was that the pounding or just, okay, thank you. The direct beneficiary herself, focusing only on female beneficiaries, right, and talking only of her dietary diversity. And one of the advantages to that is that we have the research that has created the new population level indicator of minimum dietary diversity for women. So we know what those food groups are. We know what the threshold is that we can use. We know scientifically what that means in terms of the probability of an adequate, nutrient adequate diet. So we actually think this is a really cool potential indicator. And the other advantage is it's a much broader indicator. The other one was just value chains. So if you're doing home gardens or if you're doing diversification of production at the farm level for sustainable intensification, that nutrient-rich value chain commodity doesn't capture the results of that. But this one should. And it captures both the direct production to consumption pathway and the income to production pathway. Because if the beneficiary used the income to purchase a more diverse diet, we can capture that as well. So we think it's pretty cool and welcome whether your feedback on whether you think it is too. And then finally, sub-IR 1.4 is improve social and behavior change communication strategies. And you'll notice that, thanks to Mike, we have a very comprehensive list of different kinds of indicators to capture different pieces and approaches, et cetera, for behavior change communication strategies. But what we've pulled out are 2 indicators that capture really broad brush, very common approaches that are used in behavior change. And the first one captures the person-to-person, more intensive counseling, which we believe is an essential element of successful BCC strategies. And the second one captures another component very commonly included in successful SBCC strategies, which is more the mass media type of campaign. And we think between the 2 of those, we could get a really nice picture of the coverage of these elements of really good SBCC programming. So I believe that's that.
Okay, so it's not easy to follow Anne Swindale. She's very energetic, and IR2 is, I will just say it, I'll try to be short and sweet. It's an area that probably we could use more support on. I think because it's at least one of, there's other intermediate results as well, but at least IR2 is somewhat of a slightly new frontier for some of our typical USAID programming, I would say. And this is really about commitment to nutrition and typically at the government level or national level, but also at the sub-national level. And then the other area is that human resources in nutrition, not just necessarily the community health workers, but at that higher level, university level even. And so these are, I would say, I think others would agree with me, somewhat new areas, but we recognize are very important to the success of the strategy. And so they are a mix. These indicators are a mix of external source information as well as some USAID project monitoring. And we have some influence by using other tools that are out there. And I don't know, I'm actually curious how many of you are familiar with this. There's the Hunger and Nutrition Commitment Index. All right, we have one hand go up. That's great. It's work that has been done particularly by UKAID, formerly known as DFID, as well as Irish Aid, working with the Institute of Development Studies, and it's really focused on commitment to nutrition. So at the IR level, this is not a new indicator. It's why it's in italics. Percentage of national budget allocated to nutrition. And I'm actually also curious. I think that's maybe something we're not reporting on as much these days. But again, we want to do more of it. So next. So now we're going to talk about the sub-IR levels within IR2. And this is that area of human resources, professional capacity, and our indicator is a new indicator that we've developed, is number of individuals receiving nutrition-related degrees with USG support. And we decided, we were debating about this a little bit. Should we just look at graduate level? In my experience, there's not a lot of graduate level studies in nutrition in some of the countries where I've worked, but I know that does exist in many countries where we work. So we decided to try to disaggregate that. Again, looking for your feedback. I'm sure those of you that may have worked in human resources for health might have some other ideas as well. Next. So at the IR 2.2 level, increased political will and resources, this is coming from that Hunger and Nutrition Commitment Index. And just to say, this is actually a composite of 22 indicators looking at 45 countries, some of which do not overlap with where we're working with within USAID. However, we extracted indicators as part of that index within this HANCI, or I don't know if you say Hanky or not. Luckily, this is not a pneumonia discussion. But basically, one of the indicators is budget dedicated to nutrition, and there's a score of 0 to 1, as well as whether a national nutrition policy plan or strategy exists. And I just made a little note on there for the link. And then the two countries that we noticed that were missing of Feed the Future are Haiti, Tajikistan, and Honduras. So at the IR 2.3 level, increased stakeholder engagement. We have whether a national, a multi-sectoral, multi-stakeholder coordination mechanism exists or not. And that's based on, there's information from Scaling Up Nutrition country reports as a data source. And for 2.4, improved systems to plan, manage, and evaluate. This actually goes against a little bit of our work, because DHS is typically every 5 years, but where the indicator is, has there been a DHS or mixed survey or a comparable nutrition survey in the past 3 years, yes or no? And I realize there's other areas that we could be looking at as well. And that's, I believe, the end of IR2.
Thank you, Mike. Okay, so IR3, which is increased multi-sectoral programming and coordination for improved nutrition outcomes. These are IR3 and IR4. These are the two IRs where there are very few indicators out there. We looked at our own existing indicators. We looked at SUN indicators. We looked at many, other donors indicators. And I have identified a few of them, which we presented here, but these are the two IRs where probably we need most help from you to identify indicators or even to develop new indicators. So the IR 3.1, which is increased joint planning across humanitarian and development sectors, and the indicator that we are proposing, which is an existing indicator, number of countries with joint plan in place, or number of joint planning mechanisms in place at country or regional levels. The next IR is a strengthened, coordinated, multi-sectoral programming and planning among nutrition stakeholders with the U.S. government and at the country level. We are proposing these two new indicators. One is number of multi-sectoral planning meetings where USG is present, and number of USG nutrition coordination plan meetings. So again, these are the two indicators that we thought about, but we really appreciate your input and to either to think about that whether these two indicators that we identified are appropriate, or even to think about new indicators that you may propose. For IR3, increased multi-sectoral programming and coordination for improved nutrition outcomes, and strengthened engagement with the private sector to improve nutrition. We have identified one indicator, which is again an existing indicator, and many of you might be familiar with that. Number of public-private partnerships formed as a result of Feed the Future assistance. This is an existing Feed the Future indicator. For IR4, increased nutrition leadership, we have, again, for 4.1, improved global coordination among donors, international organizations, partner countries, and other stakeholders addressing nutrition. We are proposing a new indicator, which is number of global donors serving in Sun country donor convener roles. These are all we are at the implementation partner level indicators. So if we agree and if we finalize them, that we are hoping that we will be collecting those. Strengthened and expanded nutrition evidence base. So these we are proposing two indicators. One is from STEER, number 6, which is number of scientific studies published or conference presentations given as a result of USG assistance for research programs. This is aggregated for nutrition studies. And then the next one is amount of USAID or USG funding allocated to research, impact evaluations linked to nutrition activities or programs. That's a new indicator. And IR 4.3, which is increased generation of innovative practices and technologies. We are proposing one indicator, which is a number of nutrition-related tools, technologies, or practices introduced. This is new, but this is an adaptation from an existing STEER indicator. And then 4.4, which is increased application of evidence-based approaches and innovation, including use of technology. That's for you to identify. We couldn't thought about an indicator that is appropriate for that particular IR. With that, thank you, and I will give it back.
I think with this, we'll go on to the comments section. We have an opportunity now for discussion, obviously, along each of these IRs and SO and the goal level. But also for those online, we will be looking at what you put in the chat box. And for everybody, you may also provide your comments. And I know the deadline is short, but at the USAIDnutrition@gmail.com email address, if you have anything that occurs to you after this meeting, or if you want to share it with other colleagues in your organizations and provide us feedback by October 13th, about noon, October 13th. As mentioned, we also have feedback forms that have been handed out today. And to reiterate what Sally mentioned, if you propose adding indicators, we would also like you to suggest what we could cut. So with that, let me we'll facilitate. Yes, that's the feedback form.
So I think we're going to start just going through the IRs in order. So can we go back to IR1? Yeah, we can start the SO level. I think we'd want to spend a minimal amount of time on the SO level because these aren't ones that aren't necessarily being collected. Do we have an additional mic that we can use to pass around?
As a general question before we get into each one, can we assume, I imagine so, that there's going to be fairly clear definition of a lot of these elements? I mean, that would be really...
Right, so every indicator would have a reference sheet. So we have them, I think the best place to see sort of the format of them is on the Feed the Future website under Progress. There are all of the Feed the Future indicators. We have an indicator handbook that has all of the reference sheets for all of the indicators listed, and any indicator that is new will have a reference sheet developed that would explain the collection.
Hi, thanks. Right into the mic. Are you hearing me? Okay, thanks. Diana Sukol from Santa. Thank you very much for the presentation. A lot of work went into this, so it's pretty impressive. Just two quick questions. Actually, a question to you, and then a clarification on the goal and SO levels. In terms of the goal, I just want to know what you really mean when you say secondary sources. What was said in the presentation was there was an allusion to DHS and mix, but say on the Food for Peace side, indicators such as stunting, wasting, overweight, and maybe not anemia, are collected through population-based surveys that are undertaken by, at present, external contractors. And so that's not really secondary, but if you're defining secondary meaning the PVOs don't need to collect them, so there's no burden in relation to them, that's fine. I just wanted to know what you mean by that, because those indicators, to my mind, are not always collected on a secondary basis in some of the programs. And then the second question has to do with the strategic objective. I don't know whether this is worthy of note or not, but when I look at the 4 indicators that are posited under the strategic objective, 3 of them to me relate to practice, exclusive breastfeeding, MAD, and minimum dietary diversity for women, where the first one relates to low birth weight, and that's more to me an outcome. So I'm wondering whether it disturbs you to mix indicators that relate to practice with indicators that are an indicator that to me is actually at a higher level. I would have seen low birth weight being moved up to the goal level, but it's neither here nor there. Maybe there's a rationale. Thanks.
So I would address I'll let
They're all included at the SO level because they are outcomes that contribute to decreasing stunting, decreasing wasting, decreasing the highest level impact indicators that we have up at the goal level. They may be different levels of outcomes, but behavior change is an outcome. And low birth weight may be an outcome of changes in behaviors or improved access to the appropriate services, but they are all outcome level indicators. They're just measuring different elements of outcome, and they're all lower level indicators than the goal level indicators, which happen if you manage to successfully do what we have at the SO. And it's also, they're indicators that we believe are closer to the manageable interest and accountability in our countries, right? Because they are closer to the services that we are trying to deliver and change. And there are more things that come between that and the highest level impact indicator. So that's basically the thinking and the logic behind that. We are looking at measuring these indicators at a country level. So the Food for Peace indicator, the Food for Peace measures of stunting in Food for Peace program areas would not be included in the reporting for stunting at the goal level. Okay, so the only exception here would be for the no, and actually that's it, right? Because we want to get the minimum dietary for diversity for women integrated into DHSs and mixes. So, so your point is correct and well taken that it's not secondary data because we are paying to have it collected directly, but that's not applicable to the sources of data. It's at the country level, yes.
And just to add, I mean, one thing we considered was looking at, below the country level, looking at regions where USAID is actively funding projects rather than at the national level. So that's something we debated, and we came out at the national level, but that's, if people have opinions about that, that's also something we would like to hear from you all about.
Sorry to hog the mic, but just to follow up to that, if that's your definition, then how do you reconcile the lower level indicators, which indeed will be collected by partners but won't span the entire country necessarily?
Well, we have a mix of them, right? So the IR level IR1 level indicators, a lot of them are at the country level. If we're getting them from the DHS, they're just of lower level outcomes. They're not at the higher, you know, so it's the percent of kids who get vitamin A. That's still being reported at the country level. It's very difficult for us to report for USG-assisted areas within a country using DHS data unless we go and get the actual data sets and pull all the cases, and that's not likely to happen. And then some of it, like the women and children consuming nutrient-rich value chain commodities, we can only report it for the Feed the Future zone of influence because that's the only source of data, and those are the areas where these value chains funded by USAID are promoting the nutrient-rich commodities. So we have a combination that is both the source of the data, the type of programming that is done. There is a lot of nutrition programming that works to improve health systems and have countrywide benefits. And then there's other kinds of programming like the Feed the Future program, which is geographically focused, and in that case, then the indicator itself is geographically focused. Is that right?
Thank you very much, and thanks for the opportunity to contribute to this and give feedback. I guess related to the issue of the fact that these indicators would be coming from secondary or national surveys, I guess as sort of a background, this doesn't necessarily mean that an individual mission wouldn't expect a project in a particular country to report on these. It's just that you at the global level in headquarters will be taking and reporting national level, right?
And I would say on the national level, there are some bilateral programs that do have the expectation based on their bilateral program, especially at the strategic objective level, that they are collecting those at a project level. So there are projects that are collecting exclusive breastfeeding at that level. We're not saying you can't do that. We're just saying for this purpose, it's different.
Right. I think that's an important distinction because I think I often think of a project, and what a project would report, but that's, this is kind of different. So thank you. That's all for now. I have other comments, but I'll wait.
Okay, so I'm just going to do a few online questions. So one is from Nat Sai, and I apologize if I slaughtered your name. And she said, I suggest that for all applicable indicators, we specifically indicate that data should be gender disaggregated. And if we don't specify, it may be assumed that it's optional or not required.
So I would say yes, that we are, sex disaggregation is standard at USAID. I'm sorry we didn't put that in there, but that is something that we do.
Another online question, and there's two more. So from Maurice, was explaining that the behavior change indicator in sub-IR4, as explained in a broad stroke, are somewhat weak. They were saying that the ones listed from Alive and Thrive, come closer to what behavior change should be about, measuring a behavior change from the mother and women. And will this nutrition strategy apply to all U.S. government bodies, including the PRM and MCC?
I can talk to the USG as a whole point, and I think that we'll hold off on the IR 1.4 just for a second, see if there are any more questions on the goal, strategic objective, and then we'll move to IR 1. But this is the USAID nutrition strategy, so this is applicable to USAID. The foreign assistance framework we're talking about applies for state and USAID. It applies for PEPFAR, but MCC has a different reporting structure. So we're talking specifically about USAID. Do we have any additional goal, strategic objective level comments, or should we move?
And that doesn't have to be answered here, but as you know, in a couple sessions, we've struggled with the fact that a lot of Food for Peace projects were measuring child diet diversity, maternal diet diversity, and household diet diversity. And it was a struggle to collect dietary diversity 3 times. I'm really excited to see the commitment to women's dietary diversity and the specific link to agriculture within that. And of course, minimum adequate diet is our key complementary feeding indicator. So perhaps the household dietary diversity would be of lesser emphasis.
Okay, should we move on to IR1? Yeah, so maybe Mike can get to the answer to IR1 that we are as asked on the phone.
Hi, yes. If I understood the question correctly, the IR 1.4 indicators, I believe the comment was they were a little bit vague, and that we should try to use something from Alive and Thrive, if I understand the question. And I think just to mention quickly, I'll start with the second indicator, and that is, if I'm not mistaken, that's adapted from an already existing indicator that we use on global reporting for population and reproductive health programs. And so that's kind of a quick win. We're looking for indicators that are already out there that we can use. If there is something else that people think is maybe more appropriately worded or could be changed, we're open to that. So if the comment is that it's vague or too general, please send us some appropriate language. That would be very useful. And number one is somewhat adapted from the work that Alive and Thrive is doing, and also based on work that we're doing in our programs. We realize that we really want to capture the SBCC programming. I don't think we're doing a great job of that globally, or saying what we're doing globally in this area that I think is quite important, and I think a lot of others agree. And again, I think one of the issues was we realized that just reaching a mother or a caregiver or household one time in a year really doesn't mean anything per se. So we're trying to capture that in a short time frame. And thinking about, there were other proposals for this indicator, but we felt that it may be too burdensome. I actually would be more likely to push the envelope more and say number of mothers who have repeated instances of contact from a SBCC or healthcare worker, or some people are nodding. I think that would be great. So we'd love to hear that feedback from you. Thank you. And justify, yes, we can collect this data, because that's just an issue we have.
That's, I think, a good point, that make sure that it's collectible at a regular basis, that it's not too burdened, and that it's also applicable across types of programming that are doing SBCC. So one of the reasons these indicators are general is that we're not looking at something that 3 programs in 2 different countries might be doing. We're talking about 24 to 30 different countries, and we're talking about a lot of the different approaches, both Food for Peace, nutrition and agriculture through agriculture funds and global health programs, and something that is applicable, could be applicable given all of that. So if we're talking about working with a male farmers group and giving them behavior change messages through an ag producer group, we might be able to use this. And we might be able to have something that's more widely accessible if we're talking about including SBC messages in those type of programs. So that's one of the reasons it's general, which does not mean that we don't think programs should be reporting for their own monitoring purposes, but just trying to keep that sort of more broad thinking in mind.
The indicators under Alive and Thrive 5 through 7 are capturing the actual outcome of the behavior change communication because they're capturing behaviors. And we've also been generally, and they're percent, so that's implying either a survey or a census of all of your beneficiaries, somehow getting information on behavior change. And our assumption has been that we need to be extremely cautious about requiring indicators on an annual reporting basis that measure these kinds of behaviors because of the potential burden that that implies for the partners who are the ones who are going to be responsible for reporting on this. Alive and Thrive was only operating in 3 countries with a lot of resources dedicated to monitoring and evaluation, an external party doing it, et cetera. So again, I'd go, blah, ha, 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 if you guys came back and said, we have the capacity, we have the interest, we have the ability to be able to actually go one step beyond the output indicator that's measuring the service delivery to the outcome of that, but we recognize that could really be a challenge.
And I would add that we think that the burden of the cost associated with annual surveys for every project that is working in SBCC is worth it for the purpose of being able to talk about at a global level what is happening.
Another question, keep us moving along. I'm the 1.2, increased availability of and access to high-quality nutrition-specific services and commodities, and the indicators number of children under 5 reached by USG nutrition programs, and the new addition is to disaggregate it by specific interventions. I know the community will need clarity on double counting and how that's handled.
If you have any suggestions on how to handle that, please let us know. Anyone.
Mine would be allow double counting and show it stratified or desglosado, como se dice? Completely disaggregated.
Okay. The current guidance in this area is that an individual, and this is guidance, agency kind of guidance has been around for a long time, that within an individual activity, you should be able to track your children and report the unique number of children you've reached with one or more of your interventions, right? And so the assumption is that individual activities should not be reporting number of contacts or number of different interventions, but they should be reporting number of children. And that is a reasonable expectation for at an individual activity level. What we don't know how to do and do not expect that we do and are very transparent with the GAO and the Congress and everybody is to prevent double counting across activities in a specific country, right? That we're not going to be able to disaggregate out from the Ministry of Health Information System counting kids reached with the Child Health Days and identify which of those kids are also being reached by a Food for Peace activity at a community level with community-based services. It ain't going to happen, right? And so that is currently pretty much what our guidance is. And then we ask missions if they have a sense of how much that overlap might be, to document it and to let us know. But that right now is how we deal or don't deal, however you want to define it, with the issue of double counting.
And what you could use, if you do beneficiary-based surveys, that could be a source where you can estimate the overlap between a vitamin A campaign and counseling, just looking at having questions that look at the proportion of people that receive those interventions and the proportion that are the same in your survey. And that can give you an estimate, perhaps, of how much double counting you should try to eliminate at the end. So that's one approach I've seen as an implementing partner do. And it's inexact, and it can give you, but it gives you a potential annual figure where you disaggregate your interventions based on a survey estimate of your population. So that's one approach.
I have another mission where basically they assume that all of the kids being reached by the care groups were reached by the Child Health Days, because making sure the care group kids showed up for the Child Health Day is intrinsic to the approach. So they subtracted out the care group reported kids from the total that they were reporting that was based mainly on the Child Health Day. So that's another way that they just try to deal with the challenge of accounting for double counting.
Can I just add that I like the idea of this indicator a lot, but I just feel like it's messy. And to aggregate it up, I mean, the project will categorize their interventions in such different ways, So and vitamin A, that might be integrated with SBCC. So where do you put the child? Do you say that child received SBCC or that child received vitamin A? I mean, I think so many, and do we really want to be encouraging such specific interventions versus encouraging integrated interventions? Because this potentially could discourage integrated interventions because it just gets confusing. And I totally get the point of it, and I applaud it, but I do feel like it could get really tricky, especially in the spirit of aggregating up to the headquarters level. Anyway,
Let me comment on at least the first piece. The disaggregation by intervention, we would not expect the disaggregated numbers to sum to the total. We would expect the disaggregated numbers to sum to more than the total. Okay, and so we've already sort of instituted this kind of process in the Feed the Future indicator that measures the types of technologies that are promoted, and that we allow multiple reporting so that we're able to capture the individual interventions. And then there is still the burden of taking that child that may have received more than one intervention and only reporting him or her once at the overall indicator level. So that doesn't, I mean, so at least that gets rid of the challenge of trying to say that the girl received vitamin A and BCC, and which one do I prefer to put her in? You wouldn't have to do that.
There's some online questions as well, just maybe one or two from there, and then go back to the.
And then I'll run right back. One is looking at, can we add treatment coverage for SAM, particularly in high burden SAM countries? And the second is from Marcia Griffith. Given the importance of behavior change efforts to achieving most of the indicators, will the indicator definition sheets define important related behaviors that might be critical to achieving the IR, and important to know the quality of programming behind some of them?
Will the indicator sheet define what behavior?
Sorry, and I welcome others to answer. I don't believe that we're going to.
Given the importance of behavior change to achieving most of the indicators, will the indicator definition sheets define important related behaviors that might be critical? And then it's important to know the quality of programming behind some indicators.
So we have not written the indicator reference sheets yet, by the way. So we're I don't believe, but we may want to provide illustrative behaviors my question is whether, or I'm not sure if that's being suggested or not. We do want very frank and candid feedback here. My sense is that you are suggesting it, Marcia, and I think that's the way I'm reading it. And then, oh boy, quality of programming. At this level that we're talking about today, I don't know if we're getting into that very much. I think personally, I think that we do want to have quality programs and not just have numbers of people that are hearing a message per se, but we do want to get at that quality. I don't think at this level we're talking about that, but I could be wrong.
I'm not sure that there's a measurement of quality that is easy to measure that can get at all of these programs. If somebody knows of something that how you measure quality in an easy way across projects, I'd love to hear that.
I think it also goes back to the comment I just made earlier about whether we should be asking at the activity level that you measure behavior change. Because to a certain extent, a measure of the quality of your social behavior change communications is whether behaviors are changing, right? So we have measures at the higher geographic level of a whole set of these critical behaviors that we want to see happen. If you look down at the IR level, the kinds of behaviors, women taking iron, kids getting their vitamin A, we've got minimum adequate diet. So we've got behavior change outcomes, which to me is a measure of, you can use it as a measure of how good your behavior change communication is working. But it's not at the activity level. So back to that thought about measuring it at the activity level.
The one question about SAM, we do have a number of people treated for severe acute malnutrition disaggregated by sex and age under IR, sub-IR 1.1, yes, and not coverage.
SAM it's very important, but it is specific to one type of intervention that one sort of area of programming does that not all of our countries and all of our programs do. But that's my opinion. Yes, back to there, I'm sorry.
Thank you. Can you hear me? Okay. So going back to the slide where you talk about capturing equity, and you mentioned about the top, either the ratio or right now I see some indicators where you are using the lowest wealth quintile. And in theory, I feel it's a very good idea, but I wonder how it's going to work in practice, especially considering sample size. Like some of the indicators I'm looking at, it says percentage of children aged 12 to 23 months in lowest wealth quintile with all basic vaccines. And, depending how you're going to get the data, if it's going to be, you're collecting it, I feel like you probably need to have some specific wording to make sure there's no wrong interpretation if you end up having a very small sample size and then a very large confidence interval. There's going to be room for, I guess, misinterpretation of the data. And another quick question on that too, if you could expand on the ratio, like the bottom quintile, to top quintile, and explain more like why you ended up, for now at least, you decided against the ratio.
Okay, to the first question, these are likely to come from first and foremost DHS surveys, and so the DHS sample sizes are huge, and so I think it is extremely unlikely that we would get into less than 30 cases, less than 50 cases for any of these, even dividing the sample in 5, which is what we would do for the quintile. So I don't think, I mean, the point is well taken, but I don't think for these particular indicators that we need to be overly concerned about that. We went with the bottom quintile. Okay, the ratio would be looking at the proportion covered for any of these indicators in the bottom quintile divided by the proportion covered in the top quintile, and what we would ideally see is 1, that it was equitable coverage. You know, it could be low coverage in both of them, but at least they're equitably low, right? So, but we felt that, and we were asking for your feedback on if you think that would be better, but we felt it was more understandable to a broader audience to actually just say, we want to make sure that we're getting good coverage levels among the poor, because we assume that if we're able to get good coverage levels in the 20% poorest, that we've got good coverage levels in the higher one. And so we just think it's, from a communication perspective, it's a little bit clearer to do that. Yeah.
I think the other concern I would have with the ratio is that if you remain steady, if you had low but somewhat adequate coverage, maybe you're at about 50% coverage in the lowest quintile, and then you suddenly saw huge increases, so you were at about equitable provision of coverage, and the highest quintile went way up, but the lowest quintile stayed the same, that would show up as being really, really bad, when it might just be that it's moving in a direction that's going to take time, and it isn't necessarily really, really bad, but that's how the indicator would. So that was my concern with the ratio.
Thanks. I was actually going to comment on the same thing, very similar, and I was going to say something else, and I guess there's nothing wrong with ratio of bottom quintile to top. I mean, basically you're saying a threshold is 1 and anything greater than 1 is good, but what if the top quintile isn't doing well? Should that really be your benchmark for success, even if equity is kind of, achieved? Should equity, I guess it depends on how you want to define equity. Is equity defined as well as you can do currently within that country, or is equity defined, differently relative to some global threshold? And that's why I would actually argue for the prevalence of the bottom quintile. I think there's a lot of arguments, and Sally also pointed out another sort of perverse thing that could happen over time, that not only is it easier to interpret, but that it's fraught with problems, because 1 doesn't necessarily mean great. 1 could suck, actually, for everybody. So that was one comment. Can I ask, I just had 2 other comments on the section, the IR1 section, I guess. I'm just wondering, not in the nutrition-specific suite, but in the nutrition-sensitive suite, why you might not consider including something like ANC visits, like average number of ANC visits by women. There is something on family planning in there, but it's just something you could consider. And then the third thing I want to ask, but I guess maybe it's been sort of answered, or maybe I can, my brain, I've got a cold, so I'm not focusing too well. I don't know if I heard the answer, but in the sub-IR 1.3, where you're mixing number of people type indicators with prevalence of indicators, and you did note that indicator 6 under sub-IR 1.3 is prevalence of female direct beneficiaries of agricultural interventions consuming a diet of minimum diversity, that is population level, and it would come from secondary sources. That's what was said at the time that it was presented. But okay, if it isn't, the other thing I heard happening in the room was that there might be an onus on PVOs to conduct annual beneficiary-based surveys, and it might come from that. I guess my question, the bottom line question is, when I look at the sub-IR level, those are indicators that I imagine are going to be tracked through routine monitoring systems and on an annual basis. Is this prevalence of indicators the expectation that it also be tracked annually through some population-based survey, and if so, how? Would it be through an annual survey? What do you have in mind?
Do we want to take a second question, and then we'll...
Hi, thank you very much. I'm Leslie with the FANTA project. I think going along with the nutrition-sensitive indicators, which I think are great to collect, I noticed you have one ECD indicator, but it's not getting up the 1,000 days, which I think is one of the critical, time periods and windows of opportunity to sort of integrate ECD interventions with nutrition interventions. So you're sort of missing the key window of opportunity by not having an indicator there. And off the top of my head, I'm not thinking of one. And I know there is a Clean, Fed, and Nurtured meeting actually going on today, kind of looking at potentially some nutrition WASH ECD indicators. So I don't know if something will come out of that may be in time for you to look at. But I think that's really a critical component to look at. And then, sorry, one other question. I think it's great that at the sort of overall goal and a level that looking at overweight among children under 5 and then healthy weight among women of reproductive age, I think that's fantastic. I just worry that our USAID projects going to be actually able to influence that. And some of these indicators do touch on it, but I think like having ANC visits, that will be critical to having women have appropriate weight gain and et cetera, and that's some of the few context points with the health system. But I think some of the indicators may not help you get to those overall objectives. So thank you.
I will start with, so the prevalence it's not a population-based survey, it's a beneficiary-based survey. So we're not talking, when we talk of the strategic objective and the goal level, we're talking about population as a whole. For this specific indicator, it's population, the population that is reached, so the beneficiaries, and in agriculture projects, because it's through agriculture interventions. That was our initial reaction too, and that is what sort of this research that Spring has been undertaking for us has shown, is that the agriculture projects that are implemented by USAID partners are doing annual beneficiary surveys. They are doing them, and they are asking about dietary diversity. And our thinking is if that is happening, then we should be able to sort of have it more standardized and collect it and roll it up and see what's happening across our programs. I think Anne can probably add a little bit more to that. The 1,000-day and the ECD indicator, what we did is we looked at the existing indicators that USAID collects on education, and there is not one on ECD. And we are not experts in ECD, so we could not come up with anything. So the Planning to the Clean, Fed, Nurtured would be a great place to look if people have suggestions, we're willing to take that. And then one point on the healthy weight, we talked about that a lot in the development of the strategy about the overweight. We don't currently, our funding, our programming does not really look at the broad spectrum of what would have to address overweight. There are some things that we do around promoting a healthy diet that contribute, but they're not really everything that we know needs to get done. But we're trying to be somewhat forward-looking when we were writing the strategy that this is going to 2025, and that certainly as nutritionists, we hope that that changes. That doesn't mean it will, but we were trying to be forward-looking and leave that opportunity open, and that we think at the objective level, if we're seeing huge decreases in healthy weight, that's not necessarily a good thing, and we want to track that.
And you're not required to do a survey to get a prevalence estimate. You can totally collect the information on number of food groups consumed by your female beneficiaries through routine monitoring when you're collecting information for other beneficiary-based indicators. There's nothing to prevent you from getting a prevalence if you do a census, right? And basically that's what you could be doing through your routine information system, is collecting the information for all of your beneficiaries. The comment I made about the population-based survey was just that there has been this research to develop minimum adequate diet for women, right, based on population-based surveys, and we've included that indicator as a strategic objective indicator. But we have all the definition that we need to create, which I've already started writing, the indicator reference sheet for this beneficiary-based one because we know what the food groups are, we know what the thresholds are based on the work that's been done on the population-based minimum dietary diversity for women. Okay.
So we had two questions.
So you want to go to like IR 2, 3, or 4?
You can move on to IR 2, 3, or 4, or just open up to act on any IR you have.
I have one more question about IR1, and this is forward-looking. The WASH indicators, what we're seeing in Save the Children has the clean household approach. CRS has colloquially calling it the baby wash. But we do see with the environmental enteric dysfunction focus that people are moving away from the basic community water sanitation. I don't know that they have indicators. We don't have particularly any WASH people here, but it might be worth exploring whether one or two that are more into that, the clean baby or clean household or baby wash approach.
There are two questions in the back, and we'll take both of them.
Hi, Sarah Russell with CARE. My question relates to actually IR, I think it's 1.3, with regard to agriculture. And when agriculture is mentioned and dietary diversity is mentioned, there's this link with value chain commodities. And I'm just wondering, in many cases, households grow food for consumption, household, their kitchen gardens, there are other kinds of activities that are more focused on consumption rather than on sale. And in fact, in many cases where there's this intention for people to sell commodities, it doesn't actually happen, but they may be consuming them. So I'm just wondering whether there's a clear definition of value chains, or whether it might be possible to broaden this definition beyond value chains based on other types of interventions that may occur. Or are you mainly trying to measure this for Feed the Future, which is why you're talking about value chains?
Okay, so the value chain indicator is not an indicator of dietary diversity. So there's the new indicator we've come up, which is dietary diversity of female beneficiaries of agricultural projects of all kinds. And it is very deliberately added because we recognize that the second indicator is very targeted to a specific kind of intervention, which is a value chain. And that was not sufficient. That one indicator is not sufficient to capture the nutrition-sensitive agriculture landscape. So this indicator, women's dietary diversity, you can get through the consumption to home production to consumption pathways, the income to consumption pathway. You can get it through home gardens. You can get it through sustainable intensification. It is deliberately designed to capture the outcomes of a much wider range of nutrition-sensitive agriculture activity, and that's why we've proposed it. So yes, we agree.
Hi there.
Is this on?
But you have to hold it.
You have to eat it. Okay, I'm Meredith Saggers from Land Oaks. I'm actually an M&E specialist, so I'm coming at it from that perspective. So for me, I see that what you want the PVOs to collect are from the sub-IR levels, and then everything else is sort of collected at the population sample. My question is around, most of the sub-IR indicators are outputs, with the exception of like the minimum dietary diversity. If we're waiting on the outcome indicators for every 3 to 5 years, it's problematic in terms of showing, one, quality of project and being able to continuously improving the project because you're not getting that outcome indicators from your project beneficiaries to see how effective your project is being. So I see that as a concern here if we're not having our PVOs collect outcome indicators on an annual basis.
Yeah, okay. So one of the points that Sally made at the beginning, and we really want to emphasize, is what we're focusing on here is a subset for global reporting. Okay, it is absolutely not the necessary and sufficient set of indicators to monitor progress and learn and adjust and do quality programming at a project level. We also recognize that there's a dearth of suggestions of good indicators to do that in the nutrition project arena. We are working to develop guides to help people think through what are good output and outcome level indicators. But we have this concern about the implications of requiring, right, this annual reporting up and the burden. But we welcome suggestions of feasible outcome, even if it's like immediate outcome indicators that you feel are feasible, practical, and you are able to commit your organizations to being able to measure, aggregate, and report up. Absolutely. It would be great to be able to do that. But we really try to wrestle with this balance. And maybe we tip too far on sort of the focusing on the output and giving too much weight to trying to keep it as simple and most straightforward for you all as possible. And maybe we need to, you know, tip a little bit on the other side. But that's part of the reasoning.
Should we move on to any of the other IRs, I suppose, at this point, or any other comments that people have?
Okay. So this is from online, from Maurice, and then is it possible that these indicators will change as a result of the outcomes of the Bangkok IAEG Sustainable Development Goals meeting?
We've been in discussion on what the nutrition indicators for the Sustainable Development Goals will be, and from everything we have heard, they are going to be extensions of the WHA targets. So yes, we may extend our targets to match the SDG targets, but I have no expectation that they are not going to be the same indicators or a subset of the WHA targets. That's all I know on that, and that I think is all the USG knows on that. Anyone else? Any of the other IRs? Do you have any suggestions about how we can fill in some of the blanks? Sasha, you look like you have stuff you want to say. Okay.
Hi, I'm Jennifer from Action Against Hunger. This is sort of related to IR2, and I'm not sure I can really help fill in the blanks here, but in terms of looking at country capacity and commitment to nutrition, my organization does a lot on this front, and it's something that we're really exploring intensely with some of our missions that work directly with country governments, ministries of health, and we're really struggling with defining our own indicators around this and looking at a lot of more qualitative measures. I'm wondering if USAID or any of the other implementing partners have looked at more qualitative indicators linked to issues like stories of change and sort of the results that come from more capacity building training activities directly working with country governments.
We haven't. Those are really hard to aggregate. So they can be great for one country. They can be used in reports as sort of a snapshot, which I think some of our future reports do have sort of snapshots of countries. But for the aggregation purposes, qualitative is pretty challenging.
And in my previous life at Save the Children, I think that was the approach that was taken to measure advocacy. Like, can you quantify it? And no was really the answer. I'm not sure if that's changed now. but at that time it was no. And to look at stories of change, like you said, to see how things moved from advocacy to policy to laws, and have that story told. And it's a type of knowledge and a type of information that's equally valid. So it's something to consider, and if that's feedback that we're getting, it may not be aggregatable but it may be something that we try to measure more qualitatively, including stories of change.
I attended a really interesting presentation the other day by the BFS-funded award project, which is a capacity building for African women agricultural scientists. And they were presenting the results of their use of impact stories and quantifying the impact stories to measure what were the important contributor to different pillars that they have defined of an empowered African woman agricultural scientist. And so it did pique my interest quite a bit to especially this taking the qualitative and quantifying it. So I think there may be some potential approaches out there that are worth exploring, but I just immediately run into also the concerns of how do you standardize it so that it is aggregatable across a whole bunch of really different programs doing different things, so figuring out how to do it in the context of one particular activity and then being able to use that to inform your reporting, that's fantastic, and that's the first step to see how individual activities might be doing it. But then to go that next step and thinking about writing the performance indicator reference sheet that defines how it is that you do this and what are the criteria you use to determine whether this impact story contributed this, that, and the other, I wouldn't even know where to start on that. So again, ideas welcome.
I will say one other thing, saving most of my comments for later, but building a little bit on what you were saying earlier, Mike, I feel like as I sort of get my head out of a project and put my head into USAID Global, I do see this as a huge, and I'm sure you've all thought about this before, but I'm just sort of thinking out loud here, that I think of this as a huge opportunity to drive home some key points. And so building on what Mike was saying about coverage, or sort of the contacts made, and what Marcia said about quality, and then there is an indicator in there about coverage, I feel like we can push, it seems like this is our opportunity to push it a little bit more and take a stand. And it might be challenging, but maybe we, based on recent evidence and the literature out there, we take a stand and we say, look, this is really important and this is a priority. So I would say, and I'm sure when I go back to Spring and talk to Peggy and the rest of the SBCC team, they'll agree that we should try to push this issue of contacts. I agree it's a challenge in terms of collection. I really agree. But trying to figure out some way to do it, I think, would push the envelope. And on the coverage one, one specific point about that is why not just have it as that indicator that's in there, and I'm looking at it, but it was at country level. And I wonder if it's just not, maybe it would be interventions that achieve, or the percent coverage of interventions, or something like that, so that each intervention is you're aiming for a high coverage. And that would be pushing the envelope, saying, look, if you're going to do a project that reaches like 10%, don't do it. We are prioritizing projects that have good coverage. And so I think maybe instead of making it country level, make it project level. The one, it was the one that had like 50% coverage, that one? Coverage in the district? Yeah, so I would maybe change that to be, more about the project, or like more about an intervention, or, you have to think about how you then aggregate it. But that pushes the issue of quality and coverage.
I just wanted to make a point that so globally at USAID, I think we don't always have a good idea of what's going on in the programs writ large globally, and this is our opportunity to collect that information and look at and take a look at where our investment's going, and if we have a good sense of like high numbers of SBCC-related interventions, or that a lot of people are benefiting, we have a good sense of where kind of our funding is going and what we're paying attention to. And then maybe we can look at from a country, we can look at indicators in a country and say, well, gee, certain behaviors are really low in this country, but we're really not investing much. Maybe, and then looking at our other donors in the country working in this area. I think that's also an important tool that we're going to be using this data for. So I like the idea of looking at quality. One of my mantras, I think, over the last few years working at USAID has been, let's get the basic things right. Let's get a good sense of what it is we're doing and work from there. Right now, we're really not. We don't have a good sense of globally what we're doing in behavior change beyond maybe we're getting to change behaviors 3 to 5 years down the road. I think we want to have a better sense now, or at a more intermediate level. And so that's part of this as well. This is not just reporting to Congress per se, but it's also really looking at where our investments are going. I know that doesn't really answer a question per se, but it's a comment I had.
I have a comment too. So I think we also need to take a look at where we are now on data coverage and collection. We have missions that are doing nutrition programs that are getting the data from their missions and aren't comfortable reporting it into the system because they're not sure. On number of children reached, they're not comfortable reporting that. So we have large, they're going to remain nameless, but very large countries, large investments that don't report into that number. So we are already probably going to be pushing a lot further. We also have indicators that people just don't report on. So I think we need to be balanced about how much further we push things from where they are now, where really the only indicator we have is the number of children reached. So we're talking about adding a lot, and we may not have the capacity at our missions within USAID to push things 6 steps. This may have to be an incremental change.
Hi, I'm John Hembling. I'm with Catholic Relief Services. I would think for IR2, well, I don't have specific ideas of specific indicators, but thinking about the work that's been done in HIV world around capacity building and institution building at country level that UNAIDS has done, some of those global indicators that they've used. They have indices as well around policy. I know the former Futures group did the API, which is the AIDS Policy Index. There may be some other models out there that could be used or looked at and adapted. The indicators for the Health Policy Project that I think Futures, the former Futures, I think they've changed their name. Palladium, yeah. Those might be just some models for indicators that have been submitted to USAID, but in other health areas. So I would suggest looking there. In terms, just a comment that I want to make, I think it's really interesting to be thinking about prevalence of beneficiaries that report that minimum dietary diversity for women. But then to piggyback on the comment that was just made about country missions struggling to report number of beneficiaries, it seems that there's this disconnect in terms of capacity, and I would, really thinking about who in our projects are collecting those data, what level of capacity they have to collect something that's, maybe struggling to collect number of beneficiaries or number of children reached specifically, and now asking to go to that next level, and then what does it imply in terms of who we have on the front lines collecting that very basic. I agree a census is going to be very important, and that can happen, but then actually who's going to be asked questions at an annual basis if it's not a survey comes into play. So I just wanted to raise that point.
I'd like to clarify that what Sally's talking about is some real challenges in reporting that we have from nutrition-funded activities on that number of children reached by nutrition indicators. The minimum dietary diversity of beneficiaries is an ag program, and at least with the Feed the Future funded ag programs, we have for the last many years a whole suite of indicators that you are required to collect on your direct beneficiaries. Well, both either through routine information systems or through a survey. It's better if you can build an information system that allows you to collect the information routinely, and you actually then have something that serves programmatically as a much more powerful tool in a whole bunch of different reasons. The reality is that many of the implementing partners do beneficiary-based surveys in order to collect the annual reporting data, but they are reaching, and as we said, we saw this example that these agricultural activities in Bangladesh and Cambodia were collecting it. We are working with Santa on a very large guide on beneficiary-based sample survey guide, beneficiary-based survey sample guide, because there isn't a lot of information out there about how you do these well and how you calculate sample size, et cetera, but both of them are definitely being done, and I have more confidence in at least Feed the Future funded agricultural programs' capacity to collect additional information from their direct beneficiaries routinely or through a survey than perhaps on the nutrition program side, where you have this, a lot of it is, the ones that have the most problems are getting the information from the, working with the Ministry of Health in a lot of these really big programs as well, you know, so it's just a different mix and a different kind of universe we're looking at with the nutrition-funded and nutrition-specific activities than what we're looking at with the in the ag area.
Thanks. I have two quick questions and then a comment. Just to confirm, the Women's Empowerment Index, yeah, the WEAI, that one it still remains baseline and final evaluation, right? Because it's in one of the slides that I believe the rest of the indicators are for beneficiary base.
Every 2 years for Feed the Future activities, because we collected every 2 years in our zone of influence population.
But it's on the population base, yeah, right? It's just in that slide. Okay, just confirming. The other one is why you don't have an indicator on prevalence of diarrhea, prevalence of children with diarrhea. And then a comment on the IR3. It's about, so IR, it says increase multi-sectoral programming and coordination for improved nutrition outcomes. And I've heard, I work at Fanta, so we're not implementers, but I've heard a few implementers that have complained that they don't have a lot of access to information to see what others are doing in terms of nutrition. And you know, now with technology being so accessible, and I've seen the FDF website, how you're using visualization and everything to show where you're doing different interventions, I wonder, would it be possible, this wouldn't be an indicator, but would it be possible to compile that information that you're using nutrition interventions in different countries, and even use mapping to show like the different districts, like how many people you're trying to reach? I think that would give you a lot of information, not just to you, but actually the public, to understand, you know, where the money is going, and also would empower PVOs to better target in the future and have a better idea of what's going on. And I feel like maybe a dashboard or something like that would be very useful. Thank you.
Quickly on the diarrhea indicator, and I'll let others answer the other ones. The universe of indicators that we considered for WASH under 1.3 were the indicators that are currently collected by USAID WASH programs. And so they do not collect diarrheal incidence, diarrheal prevalence in those indicators, and that's why we did not include it, but if that's something we can consider.
That would be that's constitute population-based surveys, and it is at the population-based survey level. The indicators we have at that level for WASH are the ones that are collected by implementing partners and reported on an annual basis about beneficiaries. So we don't have there are other indicators that are prevalence of not just diarrhea that we could have included, but we chose where possible at the IR level, keep it at the or at the sub-IR level to keep it at the output level. Sorry, the second question was on right. So that would be a huge undertaking. That would be a huge lift. Like the cost of doing. Yeah, that's my comment on that.
I'll just at the overall IR1 level, well, there's a whole list of indicators, the ones for the bottom quintile, and the prevalence of diarrhea in the bottom quintile is on there. It's in black. So it's one that we considered that could be useful for projects maybe to look at or something. But we went through and tried to get ones that were really more in. Yeah, I don't know. There was a debate. I think we went with all of the vaccines, and then we have the other the sub-IR level on access to the WASH. But we can certainly, and we have the prevalence of people with access to the WASH as well. So if you think it's a better indicator than some of the blue ones that we did pick, absolutely make that suggestion. Suggest which ones you would leave off, because there are lots and lots and lots and lots of the facets, right, in this list. We have to only, narrow it down somewhat. So
was that reviewed by a WASH expert? Because when we worked for Food for Peace, one of the WASH experts went through similar indicators and specifically mentioned the diarrhea one because it's so related to children's health. And even if you have, you mentioned that they have better, access to clean water or sanitation, but the ultimate, result purpose is like you see the child is sick or not sick.
Yep.
I was going to move along. Time is, yeah. I would just like to say as the multi-sectoral nutrition strategy was being developed, there was discussion about the importance of country-led processes. I think what Paul Westerfeld, was that Weisenfeld, even said we want to lead from behind a bit, and I thought that was kind of a good thing. And I do see it reflected a bit in some of the indicators you're talking about for IR3 and IR4. But where to find the balance for that, I don't know. Like the one indicator says number of global donors convening, whereas there's another indicator that number of multi-sectoral planning committees that USG is on. So just a thought. I just have this is sort of like a bit of a question removed. I have a philosophical question about the initiative itself. When I look at the document, the multi-sectoral nutrition strategy, I noticed that there's a results framework that talks more mechanistically what various institutions across U.S. government, maybe USAID, are going to do in terms of increased nutrition leadership, multi-sectoral programming, increasing country capacity, etc. Equally well, I see that there's a nutrition conceptual framework that talks more about the factors that are going to get you there, like healthy environment, WASH, increasing access and availability of healthy services, behavior practice, knowledge modification, etc. Why was this initiative focused on tracking the former rather than the latter in this initiative? Why is it important to report to government more the mechanistic part and tracking that? And then the second part of the question is, once you're looking at each other like, was that not clear? Should I? No. Oh, okay. Then
the second part of the question is once you fix on tracking the results framework, there's a strategic objective which talks about scaling up integrated nutrition-specific and sensitive interventions, et cetera, with the ultimate goal of improving nutrition. Certainly, I'm sure there's a recognition that that strategic objective in isolation isn't going to achieve the goal, that there are probably other unspoken strategic objectives that go beyond USAID and what you do. So I guess what I'm getting at is when you report to government and you report up the line, there may be a schism or a disconnect between what you see at the goal level versus what you see at the strategic objective level. And I hope that's clearly articulated or reconciled to government, that there are other actors reporting on other strategic objectives and that the goal isn't necessarily singularly achievable by USAID. So I guess those are my question and comment.
Can you clarify your first question? Are you saying why use the results framework and not the conceptual
framework?
Framework?
Yes, that's the question.
Well, I'll take a first stab at answering that. In general, when you're developing a results framework for a strategy, it is related to what the person who's going to be, or the organization that's going to be implementing activity needs to do to address the issues that come out in a conceptual framework. So first you have to understand what the problem is and what's causing it. And that's what the conceptual framework does for you. Then you have to think, what can we, as an organization, do? What's within our manageable interests? What are our comparative advantages? And that's what you develop your strategy results framework around. And then what you want to do is monitor your success in implementing what you said you were going to do in your strategy. So that's the reason that our indicators are being aligned to our strategic results framework rather than to the broad problem assessment conceptual framework. However, there are, in the list of indicators that we have proposed, many indicators that monitor the resolution of some of the primary determinants that have been identified in that conceptual framework. So the indicators themselves are not just of process indicators. They are capturing some of the issues that are identified in the conceptual framework. But it's only within U.S. government-assisted countries, for example, where it's absolutely not within our manageable interest. The other thing is that classically in results framework language, the goal is not within the manageable interest, right, nor the sole responsibility of the strategic objective that's underlying it. We know that a goal is a higher level thing that for which we are not going to be able to hold ourselves fully accountable. It's a shared outcome. Other things have to happen to be able for that to move. But if we don't see movement in it, we'll go down and look at least what we are doing. And if we're being successful in doing what we said we would do and can do, and they're still not moving the way that we want it, there's another conversation that gets open, that there are some real critical constraints that are still not being addressed effectively by the community that's interested in trying to move these impacts in these countries. Okay?
Just thank you, everyone. This is very, very helpful for us. And please hand us forms, send us your comments, continue to engage. If you wake up at 3 a.m. tonight and come up with something, please tell us. We're cutting off the comments soon because we have to submit by the 16th, and it will take us some time to compile comments. That is just not to say that if you think of something afternoon that you just think really has to be shared, share it. It may not get included in the official reporting for this time, but this is an iterative process that we will continue to work on for the next 10 years. So thank you. We appreciate everything. Thank you. And thank you again to TOPS for hosting us.
Be sure to sign the sign-in form if you didn't. There's a few copies of the multi-sectoral nutrition strategy on the table. Take food. take food. We don't want any food left.
I'm going to CFS. My last day here is this Friday.